and good alignment. I don't see any cavities. And I note her Stinson's ducts are intact. Can you raise your tongue up for me? Look at me. And her Wharton's duct is intact. Now if you say, open your mouth and say, ah. Oh, good. No tonsils. Do you have them removed? So they're not swollen. And the uvula rised on phonation, and her hard palate is intact. Can you stick your tongue out for me? Stick it out at me. That's the best you can do? Okay, it's no deviation to the right or the left.
Live.
So that's her cranial nerve 12. Can you just push up on my arms? Very good. Cranial nerve 11 is intact. Push on my hand. And can you rotate your head for me? So she has good range of motion in her cervical neck. And now I'm just going to palpate your thyroid, okay? So I will be pushing on you, okay? And I'll have you put your head down and tilt it a little to the left. And I'm going to have you take a drink, and then when I ask you to swallow, I'll be able to feel your thyroid. So if you can take a sip, and then put your head down and tilt it slightly, and swallow. Very good. I was not able to palpate any thyroid nodules, no thyroid megaly. Now I'm just going to kind of look at your hands and your fingers. I know her nail beds are without clubbing. They're pink, they're kind of cool. Capillary refill is less than 3 seconds. It's brisk. If you could close your eyes for me and tell me what I'm doing.
You're lifting up my finger.
Which finger?
The one you should be very with. The one what?
Keep your eyes closed. Can you feel my finger now?
Yes.
What am I doing?
Lifting up my big toe.
Okay, so proprioception is intact. Now I just kind of come down the chest and I note it's symmetric, and I note that her AP lateral ratio is 1 to 2. Comes down the back, and I'm just going to squeeze in. If you could take a deep breath. And her lungs expand symmetrically. While I'm here, I'm just going to tap on you. Any pain?
Yep.
Negative for CVA tenderness. Now I'm just going to listen.
Okay.
Just unbutton this a little bit, because I'll be listening to your heart and lungs while I'm here.
Okay.
Do you have any tenderness or anything in your spine, or your back,
No.
your chest? I think next semester I'll have you guys undressed in a gown. So if you could take a deep breath, in and out. Are you breathing through your mouth?
Yes.
Good, thank you. So the lungs are clear posteriorly. Another deep breath. And I hear no adventitious breath sounds. Now I'm just going to ask you to say 99.
99.
Can you say it louder?
99. 99. 99.
So her vibratory reaction is greater on the right than the left, so there may be some history there of her lung problems. Say it again.
99. 99.
And again, same issue. Left is less than right. And here, 99.
99. 99.
That's very good. And I note the costal angle is less than 90 degrees. And I will now percuss. Sounds are resonant. And if you could just go ahead and lean back in this chair for me and listen to your heart. Boy, it's really going fast now. Excuse me. Herb's point, tricuspid, and mitral. Do the same with the bell. I note there's no murmurs or irregular beats. And then I will just go ahead and listen to your carotids. You could take a deep breath, blow it out, and hold it. And I hear the pulsations, but I note that there is no bruise auscultated. Just laying you down, you're okay. And I'm looking for her jugular vein. And then I will raise her up. And I note that it disappears at 30 to 45 degrees. While I'm here, I'll just note that the contour of her abdomen is flat. And I could lie you down flat again. Is that okay? And then I'm just going to examine the abdomen, and I'm looking for any pulsations at the renal or aorta, or any abnormalities in the skin. While I'm here, I'll just palpate her femoral arteries, and I will check her inguinal nodes, horizontal and vertical. No lymph nodes palpated. And now I'm just going to listen to your belly.
Okay.
This might be a little chilly. Is tinkly vowel sounds in all quadrants, gurgles. Then I will listen to the aorta and the renal artery. For any bruise, and I hear none, which is good. Now I'm just going to put my hands under you, palpate her spleen. Any tenderness anywhere? No. I know she has a little brown nevus on her right. Has that been there all your life? Mm-hmm. It's cute. And I'm just kind of coming down the rib cage, and I'm just going to push in. If you'll take a deep breath and let it out. And I did not palpate your liver. Do you have any pain or tenderness there? No. Now I'm just going to rub on your belly very lightly. Feeling for any lesions or lumps or masses. A little deeper in pain. Am I hurting you? Scaring you? And I don't feel any lumps or masses. Your periods are okay? All right. Did I check all your pulses yet? I can't remember from the first patient to the second.
No.
So I'm just checking all your pulses. Oh, they're nice, strong pulses, and they're regular and even. Femoral pulse, popliteals, post-tibial, and her pedal pulses. Your toes are cold. Pretty toenails though, so I would not be able to check her capillary refill down there. Okay, now I'm just going to have you sit up for me. And I'm going to check your muscles and your strength, okay? And this is just what they call a little reflex hammer. I'll be tapping on you. It will not hurt you in any way. Can you just squeeze my fingers? Okay, and pull and push. Just checking your muscle. Put your arms up like so. Pull and push. Your strength. Push or pull. Okay. Dorsey and plantar flex. Push down. Okay, push up. Very good. Again, this is just a little hammer. I'm checking your reflexes. So I need to find your tendon there, okay. Tap there. Do the triceps while we're here. Okay, medial radialis. You just relax. It's not hurting, is it? And then I'm going to check your reflexes here. Very good. Caught you off guard, huh? Just relax. And check the Achilles tendon. The reflexes are intact. They're not hyper in any way. Do you remember those 3 words?
Oh, fun orange juice.
Very good. Now I need you to stand up for me.
What should I do?
And I'm just going to check the alignment of your spine. And I note that her shoulders and hips are well aligned. She has some curvature of her lower spine. Can you just bend over for me? I'm just going to run my hand down your spine. Just a slight raised area over here, so maybe tiny bit of scoliosis noted. Stand up straight, no kyphosis, no tiny bit of lordosis. You have any low back pain or anything? Okay, now if you'll just sit back up here for me.
I'm deformed.
No, you're not. You're beautiful. And I'm just going to lie you back down.
Okay.
So your spine is well aligned. I don't see any problems there. You know how to properly lift your patients, right? Using your feet. So if you could just raise your leg up as high as you can. Does that cause you any pain anywhere?
Not really, just right there.
In your hamstrings or your quads? Okay. So I would say that the Koenig sign is negative. Can you put your chin to your... That's negative for Brudzinski. And I'm just going to raise you up a little bit so you're more comfortable. And to check your Babinski. Are you ticklish?
Yes.
Oh dear. So, can you look up there and count and tell me how many tiles are up there?
Yeah.
And her toes downward flex, so Babinski is negative. How many tiles did you count?
Ms. Gauss, come on now.
Well, I asked you, so I will just...
Distract me?
Yeah. I can't get that on.
I
So,
get it.
so now I'm trying to think, did I do everything? No.
You're at 27 minutes.
Those 3 words again.
Cardinal gaze. You didn't do cardinal gaze?
Oh, I sort of did cardinal gaze. Oh, you're right. Sorry, you gotta stand up again for me. So, can you take your fingers and touch your nose?
Yes.
As fast as you can. Can you touch my finger? Very good. And just close your eyes for me. And raise your arms in front of you. Eyes still closed. So she's negative for Romberg and no pronator drift. And go ahead and sit back down.
Okay.
Something I remember doing. And
Did you percuss her abdomen?
no, I
And
didn't.
auscultate?
I did auscultate.
You did that. Okay.
No, I didn't percuss. You're right.
And the carotid.
Did the carotid.
Yes, I did the procedure.
No, I didn't carotid.
She got your
Because hers was better. There is something though. What did you just say? This rapid alternating motion you can check in many ways. So yeah, you could do this also. So there you go. And I was taking my time. You guys don't have to talk and say everything you're doing.
Good.
But I was deliberately trying to go slow. Yes, I did the expansion, and I said it was I did that right from the get-go. I did that when we first looked in the eyes. I didn't do confrontation. So you see why you have to practice and have a routine? But it can be done. And you can do it much faster than I did. Thank you so much.
Thank you.